Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this Parents and Caregiver series brought to you by Blue Shield of California's Blue Sky Initiative.
Audio Jungle. Audio Jungle.
Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Independent of the type or severity of the mental illness being managed by someone in your care, their return home from a residential facility, an outpatient care facility, or even a scheduled talk therapy session can be at times kind of jarring. During this conversation, for those who are at home helping their loved ones recover and heal, we're going to outline strategies for caring for a loved one with mental illness. And we're going to have this conversation with Doris Upshaw, an associate marriage and family therapist, and associate professional clinical counselor with HearU.org. Doris, how are you doing? Welcome back to Brother Be Well.
Hi, Michael. I'm doing well. How are you?
I'm fantastic. Thank you. Really good to see you again. And I'm looking forward to this conversation.
Nice, same here.
Let's jump on in here. Let's start by talking about that disruption that I just talked about. Your loved one is on a journey, right? They're on this path. It can be arduous. It can be kind of hard at times, and
Mhm.
then they return home. I'm wondering about that reentry period, for lack of a better term. First, I'm wondering if that's a common phenomenon, and then I'm also wondering how families can best manage that disruption. Can you help us
Hmm.
out with that?
Sure. So, short answer, yes. It is very common for one family member's journey towards healing to impact the whole family. So, as a therapist, I often tell my clients, you may start to feel worse before you feel better. I'll tell them that the days when you feel worse, the days when you feel like not showing up for your session, when you feel like it's not working, those are the days that you especially need to show up. So the same is true for the whole family. Watching a loved one on their journey is hard. Sometimes a hospitalization is the first time that everything is out there in the open. So maybe things have been left unspoken for years for many people and for families. And now that family issue within that family are all out on the table. And that can be a lot to bear. So the first step in managing the disruption, to answer the second part of that question, is first to acknowledge their journey. Know that one hospitalization, one trip to rehab, or one prescription is not a final answer. That means everything goes away. It's a process. Healing is a process.
And you touched on a few things there, Doris. Is it true? I used to think that my family was the only one that believed that you shouldn't air your dirty laundry. And then
Yeah,
as I got older and met more people, I think everybody kind of feels that way about their family, independent
right.
of ethnic group. So it's kind of natural. I love the way you put that. That in
Mhm.
some ways it's out there in the open for the very first time.
Right.
So so you're dealing internally with a lot in
Yep.
addition to trying to love and support your loved one.
Yeah, that thing that maybe you've been holding on to, or just this family thing that maybe hasn't even been said out loud within the family. A lot of times there is an identified person. We kind of talked about this last week, how everyone has a role. One of those roles that we didn't touch on last week could be the scapegoat, right? That's one person who's all of the dysfunction in the family, according to this systems theory, right? All of the dysfunction in the family kind of comes out through this one person. So yeah, sometimes this is the first time that it comes up, and it can be kind of hard or scary for not just that one person, but for the whole family.
I really appreciate you sharing that, and I heard a lot of my own family in that, and I know a
Mhm.
lot of people will too. Appreciate that. Sometimes, Doris, someone who's mentally ill doesn't want help, and
Mm.
that can be a difficult reality for those of us who love that person. We love them. We want them to get better. We know they need help. Sometimes they don't
Mhm.
even know they need help, and if they do, they don't want it. Can you give our listeners and viewers some suggestions for coping strategies for those caregivers, people who are caring for
Mm.
someone who doesn't want care?
Yeah, and that can be really hard too. Or maybe you're someone who has learned about mental health. Maybe you've been watching these videos or you have some background in mental health or social services. Maybe you even experienced the benefits of therapy yourself and you want to pour into your loved one. You want them to be seeking this help and you've learned all these things, but it feels like they're just not receptive or they're just not wanting to do it. The first thing is to take a step back. So we kind of talked about this last week too, right? Locus of control. You have to do a little bit of a self inventory. Do you feel yourself trying to control your loved one's journey? Do you feel yourself being called to be the rescuer or the one with the fix? These feelings are very natural. We get excited or we hear something and we want to help, but sometimes it's not realistic. So the only person who can control that journey is the person themselves.
That's a really powerful, and it's hard. That's a hard reality to face that they
Yeah,
really have to take on a part of it. You can't do everything for your loved one as much as you might want to.
right. So, what you can do is just to be patient and to be gentle. So, don't be discouraged by what may seem like a setback or a resistance to progress. The best thing that you can do in those instances is to just encourage your loved one to stay in counseling, right? Encourage them to communicate, for example, any thoughts of suicide or increased symptoms. Don't be afraid to say those words. You're not going to put thoughts into their head, especially when it comes to suicidality. Open up that communication, encourage them to let their providers know about medication side effects to their treatment provider. Sometimes they'll feel more comfortable just kind of mentioning it to a loved one, like, no, I'm kind of seeing things when I take this pill, or I just don't like how this feels. Encourage them to talk to their providers about those things.
And would you also say, before we move on to the next question, I was
Mhm.
thinking maybe self-care would be critically important to those caregivers who are caring for someone who doesn't want the help. They've got to remember to take care of themselves during that process as well. You think?
Definitely, definitely, because it's a long process. That process is different for everyone.
Right.
So, that sometimes is the hardest part as a loved one too, right? We see the glimpses of, oh, they're doing better, they're doing better. It can be so hard to take that on and just to know this is a process long beyond hospitalization. They're gonna need support from professionals, they're gonna need support from friends and family, especially for suicide attempts, right? For example, the first 6 months after a hospitalization are especially critical to the suicide attempt survivor's recovery. So that risk remains elevated for a full year.
I didn't know that. That's so powerful. It's a lot of great information there, Doris. Really appreciate it.
Mhm.
I'm wondering about education for the caregiver. How
Mhm.
critical is it that the caregiver's level of education about the mental illness be super high?
So I'm a big believer in knowledge is power. So for me personally, the more I know about a situation, the better equipped I feel to handle it. And it's so common for loved ones to have a mindset similar to mine, right? To deep dive into everything about a diagnosis, especially those who are caregivers at heart, like myself. But one thing I often tell patients is that a diagnosis is just a label. So it's more often than not a label, which is a piece of information to let insurance or healthcare providers know what a person may be struggling with. Maybe it's to justify an informed treatment or a hospital stay or a medication prescribed. So sometimes when it comes to mental health, we can deep dive into, okay, depression, what is that? What does that look like? But we have to remember as loved ones, the diagnosis should not redefine your loved one in your eyes. They're still who they've been all along. It's good to have a general idea of what they may be experiencing, but you don't necessarily need to be an expert on the mental illness being faced.
You have just redefined label for me. I've never thought of a label as such a positive thing before. Thank you. That's so great. It doesn't define you. It's just I love the way you put it. It's just something to let caregivers and clinicians and doctors and the pharmacists and all that know what they should be doing. That's perfect. Thank you so much. Really appreciate it.
Yeah, of course.
How important is it to have realistic expectations about what's
Mhm.
ahead, not just for the loved one, but for the entire family? And
Mhm.
then the second part of this question, I'm wondering if you can give us some tips on how to lower expectations as a loved one engages. You just touched on a piece of it. I would imagine that as the patient, the consumer gets a little better, and
Mhm.
you might get your hopes up and think they're ready to do some things. How important is it to keep those expectations relatively low as your loved one is starting to re-enter what would be considered normal life.
Right. It's always taking that step back, right? Respecting their journey. But something else to kind of add to that is you may not need to necessarily lower your expectations, but shift them. So you have to acknowledge and accept that the family dynamic will change. One big thing that a lot of times people struggle with, patients and loved ones, is I just want everything to go back to normal. But that normal will need to shift because somewhere within that normal, that loved one was suffering. And as they return from hospitalization, our rehab, readjust to being home, managing appointments now, they'll have to find a balance between treating them like normal, but also being open to change.
Really powerful. Appreciate that as well,
Mhm.
Therese. I'm thinking now about the patient, the consumer, and even as I was preparing to talk to you, I started to think about this. It takes a
Mhm.
tremendous amount of courage to return to a routine after you've been hospitalized, after you've been treated for a mental health disorder.
Mhm.
You're battling symptoms that are sometimes debilitating every day, and you've got to stay in recovery. In another Brother Be Well production, we discussed the importance of recognizing others during your
Mhm.
journey. And that came to me as I was getting ready to talk to you. I'm wondering about this principle of recognizing others, if
Mhm.
it can and should be applied with family members who are battling mental illness. So, is it helpful to acknowledge their bravery and their
Mhm.
strength and their courage as they're on the path to recovery?
Yeah, definitely. Acknowledging the struggles of others is so important. And it can help give that loved one more, what am I trying to say? It'll give that loved one more examples of voices that they can have in their own head. So the more you encourage, tell them they're so brave, give them affirmations, point out their bravery and strength, they'll then be able to use that as fuel for themselves. They have another example of a loved one telling them that they are doing a great job, right? And they're not a burden to the family. Encourage them to engage in healthy eating and exercise, regular sleep. Encourage them to engage in their own self care, relaxation activities, meditation, spending time in nature, all the things that you know are good for your loved one. It's really good to recognize that in them and share that with them. Even if you feel like they already know or it hasn't helped, hearing those words of encouragement are always helpful.
And I would think that they also, and this just came to me as you were talking, it might also help to combat stigma. We're going to talk about stigma right
Yep.
now.
Mm-hmm.
There's still so much stigma around mental illness. It blows my mind sometimes. There's still so much stigma. The minute you mention
Right.
a mental health condition and what you get back sometimes. Why
Mm-hmm.
is it so important for families and caregivers to reach out for support in this world we're living in where they care for their loved one has a battle ahead, and
Mm-hmm.
society is stigmatizing the very condition that you're trying to help your loved one heal from?
Right. There is still so much stigma. Um, One important thing is if you're talking with someone who's not your loved one, right, be in the practice of kind of validating what they're going through. We can feel very, very caught up in just like a regular conversation. That person's crazy or they're going through their thing and, kind of really other that loved one. It's just their common language. It's usually not anything malicious, but that's part of the stigma habit that we need to break, not just when talking to our loved ones, but when talking to other people, even in the family or just other people, just being aware, okay, I have someone who's going through this. So I'm just going to practice speaking differently about this thing. But I also want to add too, there is a lot of stigma, but I do have confidence that the conversation is shifting. Um, yeah, so I'll just kind of leave it at that. I really do think that it is shifting, and I think we can all help it by having different conversations, even when our loved one is not present, still being really affirming.
Excuse me, ma'am, but I'm not going to let you leave it at that because I think that's a powerful statement, and I could almost guarantee you we'll invite you back to talk about. We talk about stigma a lot here at Brother Be Well. Talk about just a little bit more on why you think that conversation is shifting with regard to stigma.
I think it's shifting mostly because I work with a lot of teenagers and young adults.
Mm,
Um, I'm quite a few years away removed from being a teenager, but when I do work with teenagers and I hear them talking in a way, I already recognize I didn't have the courage to talk about this. I never talked about my own anger or my own just disruptive feelings. I was always taught to be just very good and proper and this and that. So when I have teenagers who are doing very well in school, but also are able to freely just talk about, yeah, sometimes I don't feel great, or sometimes I get angry, sometimes I have outbursts, even something as small as that, just hearing that conversation and hearing how, these young adults are expecting, even in the workplace, to be respected, to be able to take mental health days. That wasn't a thing in the past, but I even hear the conversation work-wise shifting as well.
I had a sense you were going to talk about our young people, and I love working with them here at Brother Be Well. That's why I asked you that question. I'd agree with you. I think the younger generation are helping just completely eradicate stigma, and one day we won't even have to talk about stigma on a platform like Brother Be Well, because they get it. Some of us don't quite get it yet, but thanks
Right.
for elaborating on that, Therese. Really
Of
appreciate
course.
it.
Of course.